Good evening, everyone. Welcome to 365 Live. I'm Bina, and I'll be your host for tonight. Just a gentle reminder that all information shared at this event by the speaker and 365 CPS is for general information only. Do consult your doctor for personalized and detailed medical advice. Without further ado, I'm pleased to introduce tonight's speaker, Ms. Ng Jingwen, dietitian at 365 Cancer Prevention Society. She's here tonight to talk about how patients with prostate cancer can manage side effects from radiation therapy through their diet. Hi, Jingwen.
Hi, Rina. Thank you so much for the introduction.
Thank you very much for joining us tonight to share your knowledge with everyone. I understand that some patients who have undergone radiation therapy may have long-lasting side effects. And like everyone else in front of their screens, I'm very interested to learn how these side effects can be managed through what we eat. So let me hand over the time to you now. Jingwen, please.
All right. Thank you so much, Bina. Okay. Hi, everyone. So I'm Jingwen, dietitian from 365 Cancer Prevention Society. Thanks, Bina, for the kind introduction just now. Right. So just like what Bina introduced just now, we are going to talk about how to use diet to manage the side effect of the radiotherapy of the prostate cancer tonight. Without further ado, let's start. So before I start with my main topic today, I just would like to have some disclaimer here because later on in some part of my slide, I'll be showing some food product, some food brand, and so on. So do take note that all these examples, they are from reference only and doesn't mean that you or maybe your family member must go for this option. Right, so today we are going to talk about why radiation therapy is needed for prostate cancer and what are some of the common side effects of this radiotherapy. And last but not least, what are some of the important tips to help us to manage and to lessen the side effects from the diet perspective. So after this, during my sharing in the next half an hour, so feel free just to post if you have any question or if you have any comment, just feel free to let us know by leaving your comment in the comment section below. So first of all, let's talk about why radiotherapy is needed for prostate cancer. So first of all, for the initial, this radiotherapy can be used as an initial treatment to treat the tumor or the cancer that has been confined within the prostate gland only. And secondly, after the surgery, this radiotherapy can be also used as another treatment to further reduce the risk of the cancer recurrence. And last but not least, for advanced cancer, this radiotherapy is actually very important to help them to prevent or to relieve the symptoms brought by the cancer or the tumor itself. Okay, so let's talk about some of the common side effects of the radiotherapy. So if everyone in front of the screen, if let's say you yourself or maybe your family member that happen to be have gone through this treatment before, or maybe they are undergoing this treatment and then they experience some of the side effects from the radiotherapy, so feel free to share with us in the comment section below as well. So now let's take a look. So the first common side effect will be some bowel issue, which including diarrhea. And then later we will be talking about some of the tips to manage this side effect as well. And then the next one will be the urinary issue, which including better irritation, more urge to urinate, and then and urinary incontinence. And the next one is actually the tiredness and the weakness. And this tiredness and weakness usually they will bring to another issue, which is losing appetite as well. Moving forward, some of the patients they may experience lymphedema as well. So lymphedema meaning that there is some water retention in their lymph node. And last but not least, some of them they may experience erectile dysfunction as well. Okay, so now since just now we talked about what is the purpose of having radiotherapy and what is the some common side effects, and now I'm sure that every one of you has this question pop up in your mind, which is, can we do something about it? Right, so the answer is definitely yes, we can do something about it from different aspects. Right, maybe from medication, and of course tonight we'll be talking about from diet, perspective, like how can we manage, how can we lessen the side effect. Okay, so first of all, the first side effect that we were going to talk about is actually diarrhea. Right, so diarrhea, when we want to talk about how to manage the diarrhea, I need to talk about fiber first. Right, so do you know that there are actually two types of the fiber that we can consume from our food? So the first type is actually soluble fiber, and then the next is insoluble fiber. So before I go deep into like explaining what is the difference in between these two, maybe if let's say any one of you in front of the screen, if you heard about this soluble fiber and insoluble fiber before, feel free to share with me, like whether or not yes you have about this before, or no you haven't heard about this before, in the comment section below. And let's say if you heard about this soluble fiber and insoluble fiber, also can feel free to let me know that, oh, what do you know about these two types of the fiber. Right. So, okay. So right now I don't see there's any other comments. Okay. So maybe we give some time for like some of you maybe a little bit shy and so on. All right. Not going to be an issue. So let's moving on. First of all, it's actually soluble fiber. So soluble fiber, like the name indicate, meaning that this fiber is actually has this ability to dissolve in the water, and then they can form a gel, right? Form a gel to help us to soften the stool. And then the second is actually insoluble fiber, right? So meaning that the fiber actually don't have this ability to dissolve in the water, and in fact they can actually add in more volume to the stool, right? They add in the more volume, but at the same time they actually don't help us to absorb the water. So what we need to know about this diarrhea is actually when we experience this diarrhea, meaning that there is actually an excessive amount of the water in our intestine that our body cannot absorb. So our body cannot absorb this excessive water. It will causing this diarrhea issue, right? So maybe some of you, maybe once you after you heard about my explanation just now, maybe now you got a clearer idea that, oh, in between this soluble fiber and insoluble, which can help you better, right? Okay, so of course, right now our problem is we have excessive water in our intestine. So we need something that can help us to absorb this extra amount, this extra water, so that our stool can form a gel, and then our stool can be solidified, so that it will help us to lessen this side effect. So that's why if let's say if any one of you or maybe your friends or maybe your family members, they are having this side effect, which is diarrhea, they need to have more soluble fiber, and then they also need to reduce the amount of this insoluble fiber from their diet as well, right? So I repeat again, we take more soluble fiber, and at the same time we need to cut down insoluble fiber, right? Because insoluble fiber, they add in the volume, means that they increase our stool, but they don't help us to absorb the water. So in fact, this will actually worsen the diarrhea. Right. So in the next slide, let's take a look at what are the food sources of soluble fiber and the food sources of insoluble fiber. Okay, so I'm going to pause it for a while, just in case that if any of you find out that, oh, this information is helpful, and then you would like to take a picture or take a screenshot of this slide, feel free to do so. So about soluble fiber, some of the common food sources including oats, banana, white bread, rice, pasta, and some of the skinless fruits, for instance, pear, apple, skinless potato, and so on. Whereas for the insoluble fiber, the main food sources will be coming from whole grain products, which including bread, brown rice, and then nuts. We also got nuts. Nuts is also very high in insoluble fiber. All right, so maybe you have to take note at the time that when you're having this diarrhea, try to avoid all these food sources and try to take more the food that can give you more soluble fiber. Right. Moving on, other than increasing more soluble fiber and reduce your insoluble fiber intake, what else can we do? Right. First of all, we must hydrate ourselves. Right. So one day, 8 glasses of the day is a must it's a must for us to comply with this requirement, right? So make sure that you will drink like at least 8 glasses of the water a day. If you can drink more, that one will be this will be better, right? Other tips will be, of course, just now we did mentioning that try to have enough water, like at least 8 glasses of the water. We try to prioritize on the plain water instead of this carbonated drink, frizzy drink, caffeinated drink. Because usually this type of the caffeinated drink, they will actually have this kind of the dehydrating effect. Of course, do need to take note that you will have to avoid alcoholic drink, spicy food, deep fried food, oily food, and so on, because these food have this tendency to irritate our stomach and which will cause worsen the diarrhea as well. So in case that if any one of you have this lactose intolerance, mean that if you can't tolerate well with the lactose found inside the dairy products, like for instance, milk, yogurt, and so milk yogurt and so on, so do take note that you may need to avoid this dairy product as well. But if you don't have any issue with this lactose, feel free to continue to take this dairy product if you're sure that it won't worsen your diarrhea. Okay, moving on to the second side effect, which is the tiredness and the weakness. Right, so this tiredness and the weakness. So imagine that right now, if you are so tired, if you feel so weak, you don't have enough stamina in your daily life, definitely you won't have this energy and you won't have this desire to eat well as well. So that's why this tiredness and weakness they will cause losing appetite as well. So all these side effects they comes together usually in a package. Right. So what are some of the tips to maintain your energy level during the treatment? So let's take a look. First of all, try to prioritize protein as much as possible. Later, I will actually explain what is the food sources of the protein, what is the function of the protein, and so on. But in the meantime, maybe you can do me a favor. You can actually share with me what are the food sources of the protein that you knew already. Just feel free to share with me in the comment section below, because right now, so far from what I see, no one has been leaving a comment yet, so I'm really looking forward to that. Okay, so other than the protein food, what else we can do today? Let's say because since you had lost your appetite, definitely today, for example, you order like a plate of the chicken rice, definitely that you can't finish one whole plate. So maybe let's say you can just finish like half plate of the chicken rice only, right? Because you have been losing appetite, you don't have energy, you don't have the desire to finish everything, which is okay, which is normal. Let's say if you really experience this kind of the side effect. So what you need to do is you need to try to have a small and frequent meal. So instead of finish all your food at one go, why not we try to divide it into 2 times? Maybe you try to eat half of it first, and then you save another half, maybe just 1 hour after this, after you have taken some rest, after your food have been some of your food have been digested, then just try to finish the remaining of the food. Right. So instead of 3 main meals in a day, which is breakfast, lunch, and dinner, try to include some snack as well. So maybe you can have some morning snack, afternoon snack, and even supper. So from 3 meals a day, we can try to increase to 4 to 6 meals a day based on your preference, based on your lifestyle, and so on. Right, moving on. Of course, just now we did mentioning that since you have been so tired, you feel so maybe don't have much energy to prepare a healthy meal. So that's why we strongly encourage that try to stock up some healthy and convenient snack in your house, so that whenever the time is whenever like you feel like, oh, there's a need for you to eat and so on, just try to grab some of it and then just put inside your mouth. Yeah, so some of the example will be some like dairy products if you don't have any issue with lactose, soy milk, right? Soy milk powder, nuts. So let's say today, if you plan to cook for yourself, something like fruit, frozen fruits or vegetable will be a good option for you as well. Okay. So since just now we mentioned about try to have a small and frequent meal, so small and frequent meals. So you shouldn't be. We strongly discourage you to skip any of the meal. right? But of course, I do understand that today, if let's say we are losing appetite and so on, definitely we won't feel hunger. It's very common that we don't feel hunger at all. So sometimes if we just if we like used to eat based on our feelings, that is very easy for us just to skip one meal or two meal because literally we don't feel hungry at all. But it's actually very dangerous to do that, especially if right now, let's say you are really tired and then this losing appetite has caused you to lose certain amount of the weight. Right. So try to make sure that even though you don't feel hungry, but try to make an effort. Try to make a fixed eating schedule. Like for example, maybe you set at like 9 a.m. I want to have breakfast. And then maybe 2 hours after this, like around 11 a.m., you can try to have a morning snack. And then 2 hours after this, maybe 1 p.m., we can try to have some lunch. Right. So this will be actually a very good method for you to keep reminding yourself that even though you don't feel hungry, but you know that there is a need for you to eat, to replenish your nutrient for your body to recover. So you will make this conscious effort to remind yourself that, oh, I cannot skip meal, I must eat. Right. Okay. And last but not least, for some of the clients in which they may experience this the side effect is kind of serious, right? They really lose a lot of the fat, a lot of the muscle, a lot of the weight. In this kind of the situation, dietitians sometimes we may suggest them to take some products to help to supplement their nutrient intake. So usually this kind of the product we will refer them as oral nutrition supplement. But of course, do take note that this consumption of oral nutrition supplement must be done under the supervision of a dietitian. Hey, let's take a look at the protein. Okay, so just now the first tip I already mentioning that try to prioritize protein. So why protein is so important? Of course, protein do provide us with some of the energy, calorie, and so on. But most importantly, protein actually help us to build and repair the cells. Because all of us we know that no matter what type of the cancer treatment, it will definitely cause certain damage to our healthy body cells. So it's very important for us to eat enough protein just to give our body the materials, the nutrient that then will need to have this kind of the self repair. Other than that, this protein is also will help us to boost our immune system, will help us to maintain and build muscle mass to avoid any muscle wasting as well. Right, so let's take a look what food will give us protein. Okay, so of course I'm going to pause it for a while while I'm explaining. Of course, at the same time, feel free to take some photo or maybe take a screenshot if you find out this feel like this information is helpful. Okay, so first of all, protein coming from meat and poultry, of course, including white meat, red meat, of course. We will try to encourage to have more white meat instead of the red meat. Other than that, we have fish and seafood. They are actually a good protein food sources as well. Dairy products, again, right? Cheese, yogurt, milk. And let's say if you are a vegetarian, you can actually go for soy products, which is any kind of the products made from soybean. For example, tofu, soy milk, tempeh, tau huay, and so on. Other than soy products, you can actually try to go for beans and lentils as well. And then some nuts like for example almond, walnut, some seeds. So for example, pumpkin seed, they will actually give us a lot of the protein as well. Okay, moving on. Of course, just now we did mention that try to have some convenient food stock up in your house so that it will help to actually minimize the preparation time and then to reduce your effort. So that's why you can feel free to try to stock up some canned tuna in mineral water, some light version of the canned baked beans, some light version of the canned sardine, because all these are actually very convenient and they are actually very rich in protein as well. Not to worry, these canned products they are safe to be consumed. Of course, if you would like to take extra effort to make the diet even more healthy, you can try to remove some of the gravy from the can itself. Okay. Other than that, frozen meat, frozen fish, frozen seafood, shrimp, all these can actually help us to minimize our effort in cooking as well. Right. But how about ham? How about sausage? Because all these are actually they are so-called like convenient food as well. Can we take them? So the answer is try not to do so. Right, because other than all this sausage, ham, all this kind of the processed, ultra processed food, we also have this mock meat, or maybe we call that as a plant-based meat. The reason why we don't really encourage them is because usually this kind of the food, they are actually very high in salt, very high on oil, and in fact in some of these products the protein content may not be as much as the protein content that we can find inside the fresh meat itself. Right, so for those vegetarian, if let's say you can't really have those kind of the meat and fish and seafood, like what I mentioned just now, try to go more towards the soy products, beans, lentils, and seeds. Right, last but not least, let's take a look at some of the simple tips to help you to, just in case that you have experienced any urinary issue and so on. So first of all, of course, the hydration is still very, very important. So I know that some of you may be thinking, right, if let's say if I have an overactive bladder, meaning that I have this urge to urinate more frequent, but why are you still asking me to drink more water? But in fact, dehydration will actually worsen this overactive bladder issue. Having enough water inside your body will make sure that your body can produce more urine to help you to flush out all this toxin and the bacteria out from your body. So that's why this 8 glasses of the water minimum, we will say at least 8 glasses of the water in a day is very important to help you to reduce the risk of the bladder infection. Okay, again, similar to the diarrhea issue, try to avoid all these carbonated drink, all these caffeinated drink. Other than that, alcoholic drink as well, because alcoholic drink will actually worsen this overactive bladder issue and will actually irritate our bladder. Okay, next, this tips is actually not it's not related to the diet, but I will still include inside my slide because it's actually a very useful tips, which is do certain type of the exercise to help to strengthen your pelvic floor muscle. Right, so if you like to know more about this exercise, you can actually seek advice from a healthcare professional or from a physiotherapist. Right, so having strengthening this pelvic floor muscle can actually help you to control your bladder much better. Right. My last two tips are maintaining a healthy weight and to avoid constipation by having sufficient fiber. Right, let me explain a little bit more why maintaining a healthy weight and prevent constipation can help us to deal with this urinary issue. Right, so imagine that right now, if let's say we are overweight or we are obese, meaning that we have actually this excessive amount of the weight in our body, and actually this extra weight, right, will give extra pressure to our bladder. Right, so when this pelvic floor muscle, when our bladder is has so much pressure on it, it will actually it will actually cause this overactive bladder issue. So same concept applies to the constipation, because constipation meaning that we actually have this excessive amount of the stool inside our body, and this stool will actually give extra pressure to our pelvic floor muscle that is responsible in helping us to control our bladder. So that's why try to remove all this excess weight will help us to gain back the bladder control much better. Right. So how to avoid the cause? Of course, healthy way we have to control our calorie intake. Let's say today, if you are not losing your appetite, so then you must take note that you are not overeating and so on. Right. For the constipation, try to have sufficient amount of the fiber and try to drink more water as well. But the interesting part about this constipation is for diarrhea, you need to avoid insoluble fiber. But for constipation, you don't have to. Basically, for constipation, you can have all sorts of the fiber into your diet because because both soluble fiber and insoluble fiber, they are helpful in help us to manage this constipation as well. Right, so now it's time for me to summarize my all my sharing just now. So today we talk about what are we have an overview of the radiotherapy for prostate cancer. We also learn about what are some of the common side effects caused by this radiotherapy, which including, first of all, some bowel issue, mainly is diarrhea. And then the second is actually tiredness and weakness together with the losing appetite. And the thirdly is actually the urinary problem, which including overactive bladder, urinary incontinence, and so on. Right. So of course, let's revise again what are the some common tips to help us to manage all these kind of the side effect. So first, for the diarrhea, again we try to eat more soluble fiber and try to cut down the intake of insoluble fiber. For tiredness and weakness, we have to prioritize protein first. Again, it's a protein first, right? And then the second, try to have small and frequent meal. And then thirdly, let's say if today you have some urinary problem and so on, again, sufficient hydration is so important. And then the second, try to avoid some of the drink that may worsen this overactive bladder issue, which including alcoholic drink, carbonated drink, and caffeinated drink. All right, so that's all for my sharing today. So I think right now we can proceed to the Q&A session.
Thanks, Jingwen, for the very interesting talk. So if anyone has any questions, please feel free to share them in the comments, and then we will invite Jingwen to address them accordingly. Okay, so I will just, while we're waiting for questions, I'll just ask a few of my own. So do you have like any useful tips on how we can ensure that we have the correct amount of fiber or protein in our diet? On
Okay,
a daily
for
basis.
yes.
Mm,
All right. So fiber in general, today, if let's say we are not focusing on the soluble fiber itself, because like
mm,
in general, we can
mm,
actually take both soluble fiber and insoluble fiber. So in this case, the calculation will be much more simple. Technically, we just have to try to make sure that we eat sufficient amount of the fruits and vegetables and whole grain products in our diet. Right.
mm,
So first, I will talk about fruits and vegetable first. So for fruits, right, try to make sure that we will take like about 2 feet size of the fruits in a day. So usually, I will ask my client to try to visualize like this. So 1 feet size is actually similar to the size of a medium apple. So you
mm,
just try to make sure that okay, in a day, throughout the day, you will take this amount of the fruits, which is like about 2 medium size of the apple in a day. Yeah, but of
mm,
course, not necessarily apple. It can be some
mm,
other
mm,
fruits. Yeah, so this is
mm,
just a guidance,
mm,
right? And then for the vegetable itself, it's also 2 feet size in a day. So it's
mm,
actually you can remember like this 2 plus 2 feet size, which I will say is pretty simple. Yeah, because
mm,
it's the same requirement for fruits and vegetable.
mm,
Yeah, and then for the whole grain products, usually we can take. It's very simple to introduce whole grain products into our diet. Like
mm,
for example, if breakfast we want to have bread, instead of the
mm,
white bread, we change into whole grain bread, wholemeal bread, and so on. Rice, we can actually always change into brown rice or any types of
mm,
the whole grain rice we can see in the market. And then next, other than that, if some of us we enjoy eating cereal and all this, instead of
mm,
cereal, we can swap it into oats, which is a type of whole grain product as well. So generally, if
mm,
we are eating like this, right, we can actually consume enough amount of the fiber for our health.
Yes, thank you. So
Yes,
two feasts for fruits and
yes,
vegetables.
two fish.
Nice.
Yes, two
Yeah,
plus
that's
two.
easier to remember, right? Because
Yes,
sometimes
yes,
out there they will say, oh, you need to eat how many grams, and then like, are you supposed to weigh it, or sometimes you don't have that
yes.
ability to measure. So I guess
Yeah.
that sort of answers Victor's questions that fruits and vegetables are considered fiber. And then we have a question from Angus. Does consuming omega-3 supplements aid in fiber intake, or does it supplement our protein?
All right, thanks Angus for the question. Unfortunately, consuming omega-3 supplements actually don't help in the fiber intake or proteins. Yeah, because omega-3 supplement, most inside it is just like the omega-3 itself or the
Mm.
fish oil. Of course, you need to refer to the nutrition nutritional panel behind the supplement itself. But usually omega-3 supplement don't really give us the fiber or the protein. We have to eat the food that can actually provide us with fiber, like just now I already mentioned, fruits, vegetables, and whole grain product. And for the protein, we also can need to take it from the actual food as well. Of course, I don't deny that there are actually a lot of the protein powder, the so-called protein powder available in the market. But we seldom ask our client to take that unless they really like experience this severe kind of the side effect, like they really cannot eat, they don't eat enough, and so on. Then only we will ask them to take in the protein powder.
Mm. Thanks, Jingwen. So
Mm-mm.
next question from Terence. So how many times does it consider as too many times for going to the toilet? Yeah,
Yes,
the
you're quite
definition.
orange. Yes. So the definition for actually diarrhea. Okay, so actually, when we want to say like the definition of constipation and diarrhea, actually a lot of us we just focus on the frequency only, but actually not only we have to take note on the frequency, we must take note on the texture itself.
Mm.
Right. So, if you want to like identify like whether you are having diarrhea or not, usually we will say that if you go to toilet more than 3 times a day, and then every time the texture of the stool that you're passing out is actually all this kind of the watery stool, then only we will consider it as diarrhea. So let's say if
Mm.
every time you just passing out to the stool is like well formed, this kind of the solid stool, and then you just go to toilet maybe like 2 3 times, then actually we won't count it as so-called like diarrhea.
Mm. Okay, so it's more of the consistency of the stools more than the
Yes,
frequency.
yes,
What
yes.
about
Oh, actually we
urinary?
consider both lah.
Both.
Yeah,
Okay.
both consistency and
Mm.
frequency. Yes.
What about like urinary incontinence? Like for example, one person drinks 8 glasses of water as recommended. How many times are they expected to go to the toilet for? Like, is there a normal
Oh, oh,
range?
this one I may have to do some research about it. Yeah. But usually it's a bit unlike the unlike the diarrhea. Usually we
Mm.
don't really like because this urinary incontinence, right? It also depends on individual like it's kind of subjective because for
Mm.
some people once they got this feeling they will straight away go to the toilet. Then
Okay.
for some people maybe they feel like okay I
They
can
hold
still
for a while.
yes, the whole I can still hold for a while, and then they don't go like this. Yeah.
Mm.
So actually, most importantly, we want to see whether this side effect is it like giving a lot of the negative impact to their daily life and so on. I
Mm.
think like so-called quality of the life. Yeah, we
Mm.
don't want this side effect to like to give this negative impact on their quality of life.
Mm. Thank you. And
Yeah.
so I have a question related to this also. So you mentioned if somebody is experiencing diarrhea, they should drink more plain water and like avoid soft drinks or alcohol. So what about isotonic drinks? Like,
So actually,
yeah.
23 is actually acceptable. Yeah.
Mm.
Yes,
Okay. So,
and in
so
fact,
that's
if let's
okay.
say today you have diarrhea and so on, isotonic drink, or maybe of course, if you having this if you want to seek doctor, right? So usually doctor also will give you this kind of that oral rehydration solution as well. So it's
Mm.
actually the function of this isotonic drink and oral rehydration solution is actually inside they got some minerals. They can help us to
Mm.
replenish our minerals because when we are
Mm.
having this diarrhea, right, we are not losing water only. We are losing some of the minerals that are soluble in water as well. Yeah, so this
Mm.
diarrhea they will bring out all these nutrients as well. So that's why again depends on the severity. So in some of the client in which they maybe can diarrhea out until like 7 to 8 times a day, they are actually
Mm.
have a much higher risk of this dehydration. So it's
Mm.
actually there's a need for them to this take out the solution.
Mm. Thank you.
Yes.
So also on this note, in terms of food wise, so you mentioned like for whole grain products, they're considered as the non-soluble fiber, right? So if you are
Yes.
having diarrhea, you should try to avoid the non-soluble fiber and try to get more soluble fibers. So like how long I mean, how long should you stop eating these whole grain products? Like after your sort of symptoms disappear, is it still safe to continue eating after that, or like it will trigger diarrhea later on?
Usually, if the symptoms, because usually some of we will see that some of the most of the side effect actually can be managed, or maybe
Mm,
some the side effect will subside after a certain period of time of the treatment. Because I think one of the question from Victor, he's also asking that how long the side effect like after complete the therapy. To be honest,
mm,
I don't have a answer for I don't have an answer for this. Yeah,
mm,
because it's actually kind of individualized. Yeah,
mm,
for some people maybe the side effect can subside like immediately after the treatment, and then for some people it's actually need to wait for few more months and so on. It's really depends on the individual, and it's also really depends on the type of the side effect, I will say.
mm,
Yeah, but for the diarrhea part, as long as you no longer have this diarrhea issue, actually you are safe to reintroduce back this whole grain product into your diet. But of course, if you're
mm,
still worried about this, whether or not this whole grain product, this insoluble fiber may trigger back the diarrhea, you can actually introduce them bit by bit first. So
mm,
maybe at first you just try to eat a small amount of the brown rice, or maybe just to take like one slice of the whole grain bread and so on, and just to see whether is there any changes in your frequency of going to
mm,
toilet, frequency of the passing stool, and so on.
mm. So need to like monitor and sort of adjust
Yes,
accordingly.
yes. Yeah.
Mm,
But by right, once the side effect have been subside, right, the whole grain product will not actually trigger the diarrhea. Yeah, because whole grain
okay.
product is actually very important for our health as well.
Mm, yes,
Mm-hmm.
thank you. So Goki asked the question. So, like, what is the tendency to pass motion more frequently a side effect of uh, radiation therapy? So, like, uh, probably more urge to pass motion, but maybe it's not watery. Is it
Yeah,
also
I mean,
considered
like reduce ability like to hold the
yeah, yeah?
to
Is that considered?
control it. I will say it. I will say it could be. Yeah, it
Mm,
could be. Yeah. Whereas, but to be honest, I would suggest if you, let's say, if you have really have this kind of the concern, I would suggest maybe you can try to consult back with the oncologist. Yeah, because let's
mm,
say if you are not having diarrhea, then meaning that, to be honest, from the your diet shouldn't be have too much issue. So maybe you can
mm,
consult with the oncologist to see is there any other method to help with this, or maybe if
mm,
there is some, or maybe I'm also thinking it could be due to the muscle as well. It could
mm,
be. Yeah, so maybe you can also seek advice from maybe physiotherapist or maybe
mm,
from doctor to see whether is there any certain type of the exercise that can help you to like improve the control and so on.
mm. Thank you. So we have this interesting question from Shanshan. So should we take supplements during radiotherapy? So will we be considered like feeding the cancer because you like nourish the whole body, right? And will you also
Yeah.
nourishing your cancer cells?
Yeah. I think this is a very common question because among
Mm,
cancer survivors, right, there is also this kind of the famous myth in which right now I'm still I still can listen hear it from my client
mm,
from some of my client in which like whether or not like this eating sugar or maybe
mm,
eating sugar feed the cancer cell, or maybe can they do the fasting, will fasting help to starve the
mm,
cancer cell and so on. So the answer is all the same. Then again, we shouldn't do fasting in order to starve the cancer cell, and we also we shouldn't avoid intaking. Okay, but technically from dietitian point of view, right, we don't usually encourage you to take supplement unless there is a need.
mm,
Yeah, so if you don't have the need, of course you don't need to take a supplement. But let's say today, if let's say you are under this certain type of the hormonal therapy, like for example for breast cancer, or maybe you're on certain type of the medication in which your oncologist or maybe your other doctor ask you to take the supplement, I will suggest best to stick to the advice. Don't need to worry about whether this supplement will like feeding the cancer and so on, because it's the same concept like eating. We cannot fast to starve our cancer cell, because no matter all the nutrients that we put inside our mouth, that we feed inside our body, right? Actually, it will be evenly distributed throughout the whole body. Yeah. So technically, it will be distributed to some of it distributed to our healthy cells, some of it distributed to the cancer cells. To be honest, right now we don't have this kind of the technique to stop our body, to control where the nutrient go and so on. So that's why the proper method should be receiving the proper treatment first. It could be surgery, it could be radiotherapy, it could be chemotherapy, because this therapy, right, will help to remove all these cancer cells, so that we make sure that all the nutrients that we feed inside our body will only go to the healthy cells. Yeah, because all these cancer cells have been killed off by the treatment and so on. Yeah. So of course, should we take the supplement during the radiation therapy? I would say this one again depends. Yeah, if you are eating well, you are eating a healthy and balanced diet, then the supplement is actually it's not necessary. So unless today you got this like from your blood test, oncologist found that you are lacking in certain type of the nutrient, for example vitamin D, for example calcium and so on, and then doctor prescribe you with the supplement, then I would suggest just continue to take it.
So I guess in general, like we try to get our nutrients from the food directly instead of through supplements, unless the doctors recommend.
There's a need.
There's like a medical need.
Yes.
Okay, nice. Then I guess that sort of also addresses Terence's question on supplements. So I have this question. So for example, we have like relatives who are going through cancer treatment, and they say that they don't have any appetite, right? And then we ask them, so do you crave for anything? And what if their cravings are like unhealthy things, like fried chicken or like fatty, oily thing? Then is it okay for us to get that for them to eat, or like still cannot?
Okay. So I would say that the interesting part about the diet is actually the diet can be adjustable based on the condition, the need of our client. So let's say I think the example you give me just now is actually the client is actually having this kind of the losing appetite. Yeah, he or she don't have the appetite to eat and so on. So usually one of the management is actually like what you mentioned just now. Actually, we will actually encourage our client to think of what they crave for. And then if let's say they got something that they crave for, like even though it could be something that is like not it's like not, we so-called not unhealthy and so on, we will still ask them, it's okay, you just proceed, you just continue to eat this. Because we know that today, if like we imagine ourselves like we don't have any appetite, and then dietitian still ask you to eat a lot of like healthy food and so on, to be honest, this will actually further impact their intake. Yeah, they will actually even lose their appetite more. Yeah, of course, this concept only applies to those like really losing their appetite lah. For some other client, if they are managing their side effect well, if they don't have any losing appetite, say I still have appetite to eat and so on, then I will actually say that okay, then if this is the case, you stick back to the healthy diet concept.
Yeah, that's interesting. Yeah, because we always
so it's actually
like,
adjustable.
Yeah, I mean,
of course,
so it's quite flexible lah.
Yes. So a lot of client kind of shocked lah. But actually, I will guarantee them like this type of the diet, I mean, this type of the concept is actually temporary. It's a temporary thing. It's a transition thing. Like after like you get enough nutrient during this critical period, after this, when you feel better, you recover and so on. Of course, we won't ask you to do this anymore. Yeah, we will just ask you like, okay, go back to the healthy diet. It's time for you to go back. Yeah.
Okay. Just to get them enough strength to sort of continue on, right?
Support them, yeah.
Support them. Okay, nice. I mean, that's quite logical also. So we have a question from Goki on taking whey protein powder to ensure protein intake. So I guess just now is this considered like a supplement, uh, or would you think that it's still better to eat normal?
Of course, protein powder is considered as a supplement.
Mm,
Appropriate or not really depends on the case by case basis.
mm,
Yeah, usually when let's say if you come to a dietitian consultation, usually we will do assessment first. So let's say
mm,
if today I got this client A and client B, like client A come to me, she can actually eat. I mean, he can actually eat quite. His appetite is quite. I would still so called fair. Like still, he
mm,
still can eat certain amount of the food, just that he feel tired and so on, but he still can eat. So if this is the case, I will try to ask. I will try to teach him on how to calculate the protein, give him some meal plan and suggestion to help him to increase the protein intake in his daily life, so that make
mm,
sure that he don't need to rely on all these like protein powder and so on, right?
mm,
Whereas maybe at the same time I got another client B, in which he actually can't eat well. Again, like every meal he can only just eat like maybe 1 2 spoon, and then he feel like, oh, I cannot eat anymore. Yeah, I can only drink. Yeah, so eating solid
mm,
food is kind of like impossible for me and so on. So if
mm,
this is the case, right, and I will also take note on I will also try to assess their weight status as well. If let's say
mm,
client A maintain his weight pretty well, but client B don't really maintain his weight, he's actually losing a lot of the weight, got a lot of the muscle wasting. And then at this point of the time, yes, I'll actually strongly suggest oral nutrition supplement. Yeah, but
mm,
instead of the protein powder, again, it also depends. If the client B is not really eating very well, instead of the protein powder, I may actually try to ask them to go for this kind of the supplement drink that will actually
mm,
give them all sorts of the nutrient, all sorts of the
mm,
energy, including carbohydrate, fat, and
mm,
protein, instead of just focusing on protein only. Yeah,
mm,
so actually we don't say that it's appropriate or not appropriate. It's actually really depends on whether there's a need or not.
mm. So like their physical condition and whether,
Yes, yes,
yeah, the
yes.
ability to eat also, right? So I
Yeah.
guess in general it's always safer to consult your doctor or dietitian to see whether,
Mm-mm-mm.
like before taking in all these things to
Yes, 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 yes.
supplement stuff.
Yeah, yeah.
Mm,
Of course, I do agree that protein powder, there is a need to, for
mm,
some people, there is a need to take them.
mm,
There is always this kind of this group of the person who may need that.
mm,
But it's just that a lot of people, maybe they just take it, but without knowing that, oh, maybe actually they don't need to take at all. Yeah, so our job
mm,
is actually to help them to assess like whether do you have this kind of the need. If you have, then go for it. If you don't have, then we can go for another method.
mm. So on this note, how much protein should a patient with prostate cancer have uh,
Oh, this one
in their
again is
normal?
yes, individual. Yeah.
Also depend on
Yes,
individual.
individual. Yes,
Mm.
yes. Of course do have this kind of formula, like for example,
Okay.
1 gram per kilogram,
Based on the
body weight
person's
per
weight
day.
and
Yeah, so it's
okay,
actually
okay.
based on the body weight as well. Yeah.
Okay. So yeah, if anyone who knows a patient who might need to visit a dietitian, then please do refer them to one instead of like, just I think you
Yes,
need to
yes,
eat more
yes,
than
yes.
yeah,
Yes,
because not
we
anything
are
more
here.
is
So
good,
feel
right?
free to refer to
Yeah,
our society as
we have
well. Yes.
dietitians available
Yeah.
at 365 Cancer Prevention Society, and I guess they are very experienced with like patients with like different types of cancers, right? So
Yes.
okay, Meng Hui has a question on potassium level. So is there? I mean, we discussed a lot about supplements already, right? So maybe
Mm-hmm.
we talk about like healthy foods, like natural foods. Is there any food that is higher in potassium that people can eat if their reports show that they have low potassium
Of
level?
course, of course,
Mm,
there are actually a lot of the food that is high in potassium.
mm,
But of course, maybe for your mom, right, I will say that need to really depends on her treatment. Yeah,
mm,
like what kind of the treatment? Because I don't think radiotherapy, based on my experience, radiotherapy don't really help, like will lower the potassium
mm,
level. It could be like chemotherapy or those kind of the therapy that will actually maybe the drug is involved and so on. Yeah, of course,
mm,
maybe diet, it could be one of the factors, because
mm,
if your mom is like eating lesser at this point of the time, maybe she don't
mm,
take enough potassium from the diet, which could be
mm,
due to medicine, could be due to could be due to the diet. This one could be due to many factors. All right. Of course, again, depends on how low the potassium level is. Because by right, if her potassium level is like kind of low, I'm sure that doctor will give some potassium tablet and so on. Of course, diet. This one can what should you take to supplement? I will suggest depend on the severity first. Yeah, because if it kind of severe, definitely doctor will do some definitely doctor will take some action about it. So let's say if today she already got the potassium tablet prescribed by the doctor and so on, continue to take it. And at the same time from the diet, I think the most common food that we know that is rich in potassium, definitely first banana. Okay, banana, and then actually fruits and vegetable, they are generally very high in potassium as well. Yeah, so can try to like eat more this kind of the food to help us to like improve the potassium level. Yeah, usually supplement usually is not needed because by right doctor will hospital side they will provide the tablet.
Yeah. So I guess still have to consult a dietitian, right? To really get the full picture, because just from a comment alone, it's very hard to figure out what will be appropriate. So we have this question from Pauline on like side effects with numbness on toes and fingertips. Is this a common side effect for radiotherapy, or is this like a I don't know, maybe from other therapies?
To be honest, this time I assume it should be referring to this peripheral neuropathy, which to be honest is a very common side effect from the chemotherapy. But
Okay.
yes, but unfortunately, this type of neuropathy, because it's actually involving the damaging of the nerve, right? To be honest, nutrient wise, usually doctor will prescribe with the vitamin B12 supplement. But to be honest, other than that, there's actually not much thing diet side can really do. So take the supplement prescribed by the doctor, healthy and balanced diet, and then actually most importantly is the exercise. Right, because this numbness, right, we actually cannot guarantee whether or not you will get fully recover from it because it's a nerve damage thing. Yeah, but having a proper exercise taught by the physiotherapist can actually help to manage and lessen the side effect.
Okay. So we will just take one very last question and one very interesting question, also from Shan Shan. So nowadays, like the chicken we eat, they say it's injected with hormones, right? Is it like bad for cancer? You know, what is your take on this?
Again, another very common myth. Yeah, but actually not to worry everyone. Actually, a lot of the country, right, they already like so-called inhibit this kind of the hormone injection inside the chicken. So the chicken injected by a hormone is actually are prohibited in a lot of the country, and then especially like in Singapore, right? So all the chicken actually they are free from hormone, so it's okay. No need to worry about it. No need to really go for organic chicken and so on. Of course, chicken definitely got injection, but this injection is actually not hormone. It's kind of like an antibiotic injection. I would say it's a must because chicken gets sick as well. Then we don't want our chicken to get sick. Later we cannot eat them or eat this chicken as well. Yeah, so actually there is no evidence suggesting that chicken will actually cause the cancer cells to grow faster. Yeah, so feel free to, if you're a chicken lover and so on, so feel free to continue to consume it. But of course, don't eat those deep fried chicken and so on.
Yes. Okay, thank you so much, everyone, for your participation, and thank you, Jingwen, for answering all our questions. So it's now time for Jingwen to take her leave. So once again, thank you very much for sharing your professional insights.
All right. Thank you, everyone, and thank you, Bina.
Do like, share, and follow us on our social media pages for the latest updates on our events. Once again, thank you very much for joining us tonight. I hope to see you all in the next session. Take care, stay healthy, and good night.